Hello, I'm Dr. Anna Saylor with Every Chiropractic Center, and today we're actually talking about scoliosis. We get a lot of questions about what it is and how chiropractic can help. So I just want to go through a couple, first of all, what it is, some of the quick tips that we can give you, and then how a chiropractic can make a difference. So first of all, scoliosis. So you have three normal or natural curves in your spine. And from the side, you're going to have a C curve in the neck. You're going to have an opposite curve in the thoracics, and then you're going to actually have a nice curve in the lumbar. So those are normal curves. The curves in your body actually give you that bounce or that play. So every time you walk, it almost acts like a pogo stick. It gives you some bouncing. Scoliosis is a lateral curve, and you can have it a couple different ways. You can have like a C curve, so it'll be a lateral curve of the spine, or you can have an S curve, and that's going to be, this guy's not as bendy, but it's going to be different curves like this. Most of the time you don't even know that someone has scoliosis because you can't really see it. Our body has a natural righting reflex. So what that means is its main job is to make sure your eyes are straight ahead so you don't fall down. So if you look at someone with scoliosis, a lot of times you can't even tell that they have it because they look straight. And you might notice some unevenness in the shoulders, you might notice some unevenness in the hips, but you're really not going to notice even someone that has a really big scoliosis. A lot of times you can't even tell. Okay, so that being said, a lot of times scoliosis is undetected. So we'll see it with our scanning equipment that we have here, and we'll say, oh, did you know you have a scoliosis? And a lot of people are like, actually, they'll say no. And especially nowadays, in the past, middle schoolers used to have, and I know a lot of people would remember this, you would actually have a scoliosis check. You know, you would bend over, a nurse would check you, go down the line, especially girls, and they would actually check for scoliosis. And from what I'm gathering now, it does not happen in schools anymore. So a lot of times you don't even know that your child has scoliosis or that you have scoliosis. It's usually found randomly on an exam. So when the testing that we do in the office, we actually do a posture analysis, and then we do a nervous system scan. And that's a lot of times you can see that the rib is off, or the hip is off, or the shoulder blades are off. So I'll walk through that with you, that things I'm having you look for to actually find out if your child has scoliosis. Number one test, it's called the Adams test, and it's a forward bending test. And it is like the best place to start. So everybody that has children, or even yourself or your spouse, one of the things you want to do is you're going to bend forward and go as far as you can and touch your toes. And what you should see, and I will probably have to grab one of my daughters later and demonstrate this for you, but what you should see is a nice even, their shoulder blades should be even, the rib cage should be even, and the hips should be even when you bend forward. The number one thing that you'll see if someone has a scoliosis is you'll actually see one of the shoulder blades be off. So you might see this imbalance as they bend forward. You'll see shoulder blade is off, or the lumbar will pump up on one side. If you run your hands down their back, it's going to feel higher on one side or the other. So that is the very first way to say if someone has scoliosis or not. A definite test is an actual x-ray. So if you think, or you are wondering if your child possibly has it, I would say, bring them in here. We will do a check for sure. But then we're going to refer them out to make sure that they don't have scoliosis. And that's the number one thing with an x-ray. They'll look on, it's called Cobb angle. So they'll actually measure the degree of scoliosis. And there's different levels of scoliosis. There's mild, moderate, and severe. And so a mild curve is going to be under 20. A moderate is going to be 20 to 40. And then severe is going to be 40, 45 plus. And so if you should know, you will really notice if someone is severe. So the good news, a mild is actually really treatable. And one of the things, that's what we're really pushing right now, is finding out the early detection is way better. The earlier, the better. Okay, so who's infected? Who's affected by this? Kids are most common, and it's usually 2 to 1 girls, and they have no idea why. One of the things that, and there's always theories, but one of them is I see it more in our dancers and our gymnasts. and they talk about the balance of the sacrum, and their ballet and gymnasts tend to really put a lot of pressure on their sacrum, and so they tend to have it more often, but it's not everybody. It's not always if you're only a ballet dancer or a gymnast. So, but it is much more common in girls. It can happen in infants, and they have no idea. So the number one cause, they call it idiopathic, which means we have no idea. There's a couple other things that we're looking for. You can have a congenital scoliosis. So you can be born with, and this is a little vertebrae here, but your vertebrae should be squarish, and you can actually be born with a hemivertebrae, which means that this vertebrae might be smaller, and it's going to cause, if this side is smaller, it's going to cause some rotation, and that can cause some of the scoliosis. Some kids are born with hemivertebrae, and then that's more of a congenital issue. Next thing, like common symptoms, scoliosis usually doesn't cause any pain. So a lot of times as you are going through it, your children will never say anything about that it hurts. The symptoms you'll see, though, you will see an imbalance in their shoulders. You'll see an imbalance in their hips. You might see their spine rotating. So you might notice that one of their shoulders tends to rotate forward, or one of them is always staying back. So there's that twist. So if you imagine that they're like this, they're twisted. They're going to have problems breathing sometimes. So a lot of kids that have like asthmatic issues can have scoliosis underlying. So those are the ones that we really want to make sure that they're tested and find out about. But they actually typically will not have any pain associated with scoliosis. It's not until you get a little bit older that you actually notice the difference, and actually scoliosis can cause you pain as you get older. So it's super important. Small curves usually tend to not cause any problems. So remember, there's a very differences in degrees of curves. It's when you get into the larger curves that you're going to notice a much bigger problem, especially with as you age. Okay, so how's it treated? So one of the things we talk about, if it's caught soon enough, and this is before the growth spurt. So the sooner the better, especially we're talking like 7 and 8 year old. If you're caught before the growth spurt, you think about it. If something's off and they grow, and especially if we hear a lot of times where kids went through a huge growth spurt really, really quickly. So if something is slightly off and you grow, it's going to grow farther off. So it's really, chiropractic can make a huge difference before the growth spurt, because we want to balance the pelvis. We want to balance the hips. We want to balance. We are the experts in nervous system, structure, posture, bones, muscles. That's what we do. So if you can diagnose it early and get it taken care of early, we can make a huge difference. That being said, once you're through the growth spurt, there's a lot we can still do to help. Chiropractic, exercise, massage. There's a lot that we can do around that area to help balance it and make sure that the muscles are flexible, the spine is moving as well as it could be, the pelvis and the posture are in a really good position. So even to the point where if, you know, a lot of times it is never too late. And we heard a lot. I have a patient that came in and she is 76 and she has a pretty good scoliosis. I mean, a really, really severe scoliosis that she's had since she can remember. And there's nothing we can do to undo the scoliosis she has, but we help stabilize her pelvis, we help stabilize her muscles, we help allow her to breathe as much as possible, and she feels much better when she's getting adjusted. So it's never too late. So that being said, we do know that our goal first is prevention. Our second goal is maintenance. There are going to be cases, so if you catch it and it's a little severe, there's things that we can do with bracing. And like for us, chiropractically, even our kids that have braces, we still adjust them with the braces on. We adjust them with the brace off, because we want to make sure that their posture as much as possible is in a really good supportive frame, and then they can still wear the brace. And usually, it is not fun and it is not pretty. And we talk about, the kids that are braced are in it 24/7, and it's really not good for their self-esteem. I mean, this is why I keep talking about prevention, because if we can catch it early enough, they never have to go through the emotional and the physical component of being embraced 24/7. So, the last resort is obviously surgery. So that is one of those things that obviously everybody wants to avoid surgery. And at some point you might not have, the goal is to get it before, so you don't have to go through surgery. That being said, though, if someone has come in with surgery already and has the rods, there's a lot we can do around them. We can't adjust those areas, but we above and below it, we want to make sure that those areas are stable as much as possible too. Okay, so living with scoliosis, obviously a lot of people are living with it, and I think that's the goal is to just make sure that you are supporting your body as much as possible. So exercise and stretching, so things like yoga and Pilates are going to make a huge difference in stabilizing. If you think about the whole core of Pilates or yoga is to stabilize the posture, make sure that the muscles are elongated. Stretching is going to be a really big thing, and we show our patients stretching that when they're in the office for it too. And massage is going to make a huge difference. Okay, so the other thing too, sleeping. If you have scoliosis, you want to sleep on your side. The biggest thing is making sure that you're using a rolled up towel and putting it in the area of the curve. So if you're sleeping on your side like this, you're going to want to put a rolled up towel to support that area. So side sleeping is by far the best way to sleep. Pillow between your leg and that rolled towel wherever your curve is. Okay. So scoliosis does cause more wear and tear later in life. And so this is where the maintenance and the preventative care makes a huge difference, because anything that wears down, anything that rubs is going to wear down. And we do see an increased incidence of arthritis in our patients that have had scoliosis from a really long time, because it can cause some compression through the ribs. It can help, affect your breathing, your lungs. So really maintaining that posture. Exercise is going to be a key, making sure that you stay in a really good weight. If you're overweight and you have scoliosis, it's going to really compound the problem. I know it's easier said than done, but exercise is going to be a really key to make sure that our patients that have scoliosis are maintaining. So, okay, 4 facts that every parent should know. So this is for you, my parents out there. Early diagnosis is the key. The sooner the better. Make sure if you have any inkling or any questions, ask us. We are always looking at posture. We're always looking at our children's spine. We're always looking at that. So we catch it early. We are the ones that I feel like we are the early detectors, because we see them and we'll tell parents, pretty sure we think that they have scoliosis. Let's get them taken care of. Let's get an x-ray just to make sure, and then we'll know how to support them. So early detection is key. The earlier the better. So like I said, do the Adams test right away on your child tonight. Or if you're coming in this week, ask us and we will make sure that we check. Parents, it is not your fault if scoliosis goes undiagnosed. Because we heard a lot, like, I wish I would have known. Why did I not see it? Why, and the number one age is between 10 and 12, when kids are actually going through puberty and they start getting much more private. The things that we did when we were younger, like I used to, bathe my kids and, you help them get dressed. And that stops at about the age of 10 to 12, which is when a lot of scoliosis goes undiagnosed. So it is not your fault that you're not in the room anymore, but that's where our job is to make sure that we start testing our kids in the practice between the ages of 7 and 8. And then we want to do that on a yearly basis. So really making sure that every annual physical, they're getting checked for scoliosis. Every time they're in the office, ask us, because it is not your fault. It also, there's no cause, no one knows why. It is not the backpack. We have backpack ergonomics. It's going to affect the body, but the heaviness of a backpack usually doesn't cause scoliosis. They just don't know why. So our job is to prevent. It can run in families. A lot of times people are like, well, no one I know has it. But if someone has a mild case and they have no idea that they have it, it does tend to run in families. Especially a lot of times you'll hear it, like, as you start going through it, oh yeah, my aunt had it. Oh yeah, I actually found out later that I had it. So if someone in your family has it, you need to make sure your kids are checked, because its chances are it's going to run in your family. And only a small percentage of kids that are diagnosed with scoliosis need surgery. So they say on the average, only about 30% of the scoliosis out there actually needs bracing, and less than 10% actually needs surgery. So prevention is the key. I think that's about it, because we're just getting these questions a lot more lately, and we're finding it out a lot more earlier and earlier, which is how we should. So if you have a chiropractor that you love, call them, get your kids checked. If they do the posture app, have them do the posture app. If you don't have a chiropractor you love, then we're here for you. We're in Royal Oak at 13.5 Mile and Rochester Road. So I'm in Royal Oak, and we definitely would love to be your family chiropractor. So once again, I'm Dr. Anna Saylor. If you have any questions about scoliosis, please ask us. I will do the test tonight with my daughter as a demo, and I will definitely post it, and I'll post some things in our chat about what to look for too. So I hope everybody has a fabulous day and enjoy. Bye, everybody.